everyone. My name is Ginny Lovitt. I'm the Executive Director of the Chris Atwood Foundation, and today I'm going to be showing you how to recognize, respond to, and reverse an opioid overdose using naloxone. So before we get started, I want to give you a brief introduction to myself and the foundation. The Chris Atwood Foundation is a nonprofit that we started in memory of my brother who passed away from a heroin overdose in 2013. So I know, as I'm sure you guys do as well, how important it is to actually be prepared in advance for a situation like this if it were to occur. Before we get moving though, I want to make sure that everybody has registered for this training. The name that you use on the registration link is the name that will be put on the label on the naloxone that we send to you. If you don't register, you don't get the Narcan. So if you haven't registered yet, go ahead and pause this video, use the link that was provided to you, and go ahead and fill that registration out, and then we'll move forward. So the first thing that I think is important to talk about is what are opioids. That may be really obvious to some of you, but maybe not to others. So opioids are a class of narcotic painkiller that includes prescription medications like Oxycontin, Vicodin, Percocet, as well as illicit drugs like heroin. Morphine is also an opioid. There are many, many different kinds out there. In the curriculums that you guys have received, you can see a list of some more of those. But how are they actually deadly? They're what is called a central nervous system depressant. So the big thing that you need to worry about is breathing. The opioids will suppress the respiratory rate, and it's usually lack of oxygen that actually kills people. So that's why I'm going to tell you about how to administer Narcan, but also how to do the rescue breathing to keep somebody alive. If you were to be in a situation where you didn't have Narcan, you can actually keep somebody alive just doing the breathing. So how do you actually recognize an overdose? Sometimes people will be nodding off and acting really high, and people will wonder, is it time to Narcan them or not? How do you know? Well, there's two things that you really want to be looking for. Number one is that breathing, because remember, it's the lack of oxygen that kills people. So are they breathing or are they not? Or maybe they are breathing, but it's slow, it's intermittent, you're hearing weird noises, ragged breathing. You might also see signs of lack of oxygen. A really big indicator is blue lips and blue fingertips, or in darker skinned people, sometimes it may look like grayer lips, gray fingertips. Any kind of skin discoloration at all is a big sign of lack of oxygen. So if you're seeing any indications like that, it's a good idea to administer Narcan. You may hear something that sounds a little bit like snoring in the other room. That actually could be the sounds of somebody struggling to breathe. So if you haven't heard from your roommate in a while and you're hearing some weird snoring sounds coming from his room, go check on him. So we're checking for breathing. If it's totally normal, we're not going to give Narcan yet. The other thing we're going to check for is responsiveness. If somebody is in an active opioid overdose, they're probably not going to be responding. So I'll show you a little while later how you actually check for a response. But if you're trying to get their attention and they can't look at you or talk to you or respond to you, we're also going to consider that to be an overdose. So to recap, the two things that indicate an overdose are lack of response and no or irregular breathing. So one of the myths about overdose is that it can happen and does happen instantaneously, that you'll immediately know if somebody's overdosed. And sometimes that may be the case if they've taken a very potent opioid or something that's laced with fentanyl or carfentanil, one of those dangerous additives that are going around. But in other cases, it may actually take a very long time. It could take hours for somebody to fully build up oxygen deprivation. So if you've got a buddy who seems to be, very high and is kind of concerning you, you want to monitor them for at least a couple hours, because they might actually slowly over time slip into an overdose. So the window of time to get to somebody and save them with Narcan can be as little as 3 minutes, or it can be as long as 3+ hours. It totally depends. I think that it's important also to talk about the risk factors surrounding overdose and how we can hopefully prevent overdoses from even occurring in the first place. So most people are not overdosing on purpose most of the time. So what goes wrong? Well, there's a few things that are really common that increase your risk of overdose. And the number one, especially for folks like yourself in recovery, excuse me, is reduced tolerance. So if you've been in recovery for a period of time, if you've been incarcerated, in treatment, for whatever reason you haven't been using, your tolerance goes down very quickly. So somebody could potentially just be in jail for a weekend, and their risk of overdose goes up by 40 times just because they haven't been using for a few days. So reduced tolerance is a really, really big problem, and that's actually what happened to my brother. He was in treatment for 30 days, he got out, he overdosed, and it was fatal because his tolerance was so low. There's also another kind of tolerance called situational tolerance, which not a lot of people know about, but in a nutshell, what it means is that if you are using in a different way than you used to use, that your body is accustomed to, that is actually an increased risk for overdose as well. Because your body, when it knows that it's about to get a massive dose of depressant, it rises in its systems. It increases your heart rate, it increases your respiratory rate to compensate. But if you're using in a new situation with different people or a different method of using, your body doesn't get that cue, and actually that can cause an overdose that wouldn't have otherwise occurred. So be careful when you're, hopefully you guys obviously aren't going to ever be using again, but this is good information anyway. If you were to be back out there using in a different way, remember how much of a risk that is. Mixing drugs is another huge risk. People love to mix other depressants, alcohol, benzodiazepines like Xanax and Ativan. All of these compound each other, so mixing depressants is especially dangerous. But mixing it with cocaine doesn't negate the risk. That also is an increased risk because your body is just pulled in a million different directions. Using alone is another risk for obvious reasons. Nobody should ever use alone. Nobody will be around to call for help if and when something does go wrong. And we touched on, and you guys have probably heard about, the additives like fentanyl and carfentanil that are causing so many of the deaths. An amount of fentanyl the size of a grain of rice can kill somebody, and an amount of carfentanil just the size of a grain of salt can kill somebody. So you really have no way of knowing what's in anything. Even medications that look like they're prescription pills could be counterfeit. So there are all kinds of additives getting put in there that are increasing the risk. So in a minute we're going to talk about how to reverse the overdose. Before we do that, I want to talk about how not to reverse an overdose, and there's some myths out there. A lot of them involve water, so putting somebody in a bath or cold ice, on their genitals or up orifices. In many different places people are told to put ice. There's the myth, if you've seen Pulp Fiction, that you can stab them in the heart with adrenaline, I think it is, or epinephrine. Don't stab people in the heart. All of these things, milk, I've even heard orange juice, trying to get them to ingest those things. All of those myths for how to reverse an overdose actually have the potential to do more harm. So don't do them. The only thing that's going to actually help that person is rescue breathing and Narcan. So how do you do those things? We have Preston here, our handy-dandy sidekick, and I'm going to use him to show you how you would respond to an overdose. So if you were to walk into your roommate's room, you see him laying on the ground, and you're not sure what's going on, the first thing that you want to do is just call his name out or her name out from a distance. Hey, Preston, are you okay? If you're not getting a response, it's a good idea, and you guys are all getting these Revive pouches. We will be mailing them to you after the training if you registered. Inside are the gloves, and it's a good idea to use them just in case. There is a very, very slight risk that you could get some residue of the drug on your hands and then accidentally ingest it. So it's a good idea to put the gloves on, and then when you're done responding to the overdose, take them off and don't touch your face. If you don't have the gloves, that doesn't mean you shouldn't still help, but it's better safe than sorry. So you want to grab the gloves, put them on, and then you're going to give them a shake. Hey, Preston, wake up. Are you okay? Still not getting a response. So right now what we want to do is check for responsiveness, and the way that you do that is called a sternal rub. So you take your knuckles and you press them down onto the sternum and you rake them up and down. Or you can twist. But the idea is that you're getting bone on bone. And it's uncomfortable. It doesn't hurt them or damage them long term, but it is going to be painful in that moment. So you're trying to get a pain response. If you're giving decent pressure and rubbing up and down and you're not getting a response, we're automatically going to consider that an overdose. You can also check for breathing. You want to know if you need to do the rescue breathing. So to check for breathing, what you're going to do is tilt the head back. That'll open up the airway. And then you're going to hover your face, your cheek, right over the nose and mouth. And the reason for that is that it puts you in the perfect position to do three things. Number one, you can look from here and see if their chest is rising or falling. You can listen for the sounds of breath, and you can also feel for hot breath on your cheek. So remember, looking, listening, and feeling. If you aren't detecting totally normal breath, if it seems slow or shallow or you're not detecting any at all, you're absolutely going to need to do the rescue breathing. But first, we're going to administer Narcan. By the way, Narcan is actually a brand name for naloxone. Naloxone and Narcan are the same medication. Naloxone is a generic name. Narcan actually now refers to the nasal spray. What you guys are getting is a pretty nifty product. It's called Evzio, and it's an auto-injector. So we just so happen to get a donation of it, which we are passing on to you guys. So you're lucky, because there's not a lot of people get these because they're pretty pricey if you're not getting them donated. So it actually speaks to you, it walks you through the steps, and I'm going to demo it for you right now.
This trainer contains no needle or drug.
I hope you can hear it.
If you are ready to use, pull off red safety guard. To inject, place black end against outer thigh, then press firmly and hold in place for 5 seconds. 5, 4, 3, 2, 1. Injection complete. This trainer may be used for
So you guys actually, in the boxes of this that you'll get, you'll have 2 live doses and 1 trainer, just like this. So when you get the boxes, feel free to open them up, pull out your trainer, not the live ones, but the one that says trainer on the top, and you can actually test that out and play with it so that you're comfortable with it if you ever were to actually need it. So remember, we've checked for responsiveness, done the sternal rub, checked for breathing, administered Narcan, and now if you don't have somebody else with you, you're going to go call 911. But if you've got somebody else with you in the house, as soon as you detect that it's an overdose, have them go call 911. Otherwise, if you need to go grab the phone and leave them alone for any reason, it's really important that you put them into the recovery position, which means just turning them onto their side. And there's a diagram of this in your curriculum, so I encourage you guys to follow along with that and look at the diagram. But basically what you're going to do is take their hands, put them into sort of a sleepy head position, lying on their side, and you'll take the top leg and you'll bend the knee and put that on the floor in front of them. And that's going to keep them from rolling over onto their stomach or back. If they were to roll over on their stomach or back and vomit, they could get it stuck in their lungs, they could choke on it. It can be very bad. So this is important if you're leaving them for any reason. Calling 911 is also not an optional part of this protocol. We don't know what other issues might be going on with this person. We don't know what other drugs they may have taken. And so it's very, very important that we're getting them to the hospital. So we've administered the Narcan, we've got 911 on the way, and next we're going to do the rescue breathing. Because remember, we looked and he wasn't really breathing right, so we're going to do some rescue breathing. You have also in your kit a CPR shield, so you'll pull that out. Some people like to open those up in advance because they're wrapped up in plastic, just so that's ready to go. You'll insert the plastic portion down into their mouth, and it'll go all the way down in. And then you're going to tilt the head back, pinch the nostrils, super important. Don't forget to pinch the nostrils. A lot of people actually forget that part, and all of that air that they're trying to get into the person's lungs is very likely to just go right back out through the nose. So head back, nostrils pinched, and then we're going to breathe and count to 5, and we're going to keep doing that for about 3 minutes. So this is a little bit of what it would look like. Head back, nostrils pinched, 1001, 1002, 1003, 1004, 1005. 1001, 1002, 1003, 1004, 1005. All right, so we're going to do that for about 3 minutes. And once you think that it's been 3 minutes or so, and it's okay if it hasn't quite been 3 minutes or if it's been a little bit over 3 minutes, but once you've given the Narcan time to take effect and you're doing the rescue breathing, you're going to check to see if the Narcan's working. So we can do another quick check for breath. You can do another quick sternal rub. If you're not getting a response still, you're going to grab that second dose of FZO and administer it the same way as the first into their outer thigh. At that point, you're going to continue rescue breathing again. If at any point in this whole thing they're not breathing properly on their own, somebody needs to be rescue breathing for them. Life-threatening lack of oxygen can occur in as little as 3 minutes. So at all times when they're not breathing on their own, somebody needs to be breathing for them. If you have more than 2 doses of Narcan, feel free to keep giving them. You cannot overdose on Narcan, so it's totally safe to give 5, 6, 7 doses if that were to be necessary. Usually it's not, but sometimes it is, especially if they've got carfentanil or something involved. So now that I've shown you how to respond to an overdose, you might wonder 2 things. How does Narcan actually work? And then, what happens when they wake up? So all Narcan does is it goes into the body and it deactivates the effect of the opioid. So when the opioid molecule attaches to the opioid receptor in the brain, that's when the body starts to get that depressant effect. All naloxone does is bump the opioid off of the opioid receptor. It doesn't produce a high, it doesn't feel like anything. If I were to use it on myself right now, it would do nothing. It has no dangerous qualities. It's completely safe. You can't overdose on it. You can use it on a 2-year-old the same way that you would use it on an 80-year-old or a 30-year-old. So you can use the same dose for everybody. You can even use it on pregnant women and dogs. It's a very safe, miraculous medication. It does have a couple drawbacks or limitations, really. Number 1 is that it only works on opioids. So you could use it thinking that it's an opioid overdose, but maybe it's something else. If it's benzodiazepines or alcohol or whatever, it's not going to work on that. Only going to work on opioids. And number 2, it's also, the effects of it are temporary, which is another reason why getting them to the hospital is so important, because they could potentially go back into an overdose after about 30 minutes to an hour. So the Narcan will wear off and the opioids that are still left in the body will reattach. So that's how naloxone works. And what happens when they wake up? Well, when they wake up, they're going to be in withdrawal. They're not going to be too happy, probably. If they've developed any kind of tolerance they're going to be in withdrawal. If this was a one-time relapse, they might not necessarily, but do prepare yourself for the possibility that they might wake up a little bit agitated. They don't know what happened. All they know is they feel like hell, and there's people around panicking, and it can be a very traumatic situation for everybody. So just try to keep them calm, make sure they go to the hospital, and whatever you do what you can to make sure they don't use more opioids. Because when they're in withdrawal, that's what they're going to want to do, but it's actually going to put them at an increased risk of re-entering overdose later. So make sure that you also don't let them eat or drink anything for a while. Stay with them and monitor them and get them to the hospital. So that is how to respond to an opioid overdose. Sonia, am I missing anything? There is one thing, the sticker. So you will also have in your kits a sticker that says, "I've received naloxone." And so unfortunately this is not for your car bumper. It's actually for the person. So you want to place this sticker on there's two of them. You want to place one on their hairline and one on their chest. And this lets everybody know, including EMTs and staff at the hospital, this is an overdose situation, and it flags them that they may actually need more Narcan later, so they'll be on high alert and make sure to have more Narcan ready. One other thing I do want to talk about is the medication disposal pouches. So these actually destroy and render completely neutralized any medications that you put into them. They are super cool. You can put pills, 6 ounces of liquid, you can put patches in here, you can put illicit drugs in here as well. All you do is place whatever the substance is in the pouch with a little bit of water, shake it up, and throw it away. And it's completely neutralized. So I think this is nice for recovery homes to have, because if somebody in the house were to relapse and you find drugs in the house, you want to get rid of them ASAP, and you can do that safely using one of these. So we're going to send one of these to every house. We're also going to send a Revive pouch and a box of FZO auto-injector naloxone to everybody who's registered. So again, please fill out the registration link. Also, you should have received a link for an evaluation. Please fill that out as well. That's very important to us, to make sure that we are giving the best trainings possible. And if you have any questions after this, don't hesitate to reach out to anyone here at the Chris Atwood Foundation, and we can answer those questions for you. And I think that covers it. So thank you so much for getting prepared. I hope you never ever need this, but I'm very glad that you now have the information.